Neoadjuvant chemotherapy is a form of chemotherapy, radiation therapy, immunotherapy, and endocrine therapy to downsize a tumor, to make it smaller so that the surgeon can do definitive surgery. In some cases, also, you can do that for breast conservation, especially in breast cancer, and also for organ preservation, just like in patients with tumors of the larynx, the vocal cords, or those who have anus or in the anorectal area, so you can preserve the sphincter. So those are, it's a form of therapy that's given initially before the definitive treatment. Well, it's important. Not all cancers need neoadjuvant therapy for sure. But for most, especially in breast cancers who are quite big in size, which we see in third world countries like our country, but which is rarely seen in the first world like the United States or parts of Europe where you see early breast cancer, then we have to downsize these big breast cancer masses before the patients can undergo definitive surgery. And it also would help in terms of cosmetic wise. It's a very important part of the anatomy of a woman. So if you want to conserve the breast, then that's a very important modality to do neoadjuvant treatment and conserve the breast. So, and of course, relative to that also, sometimes the tumors can be multifocal. If they're multifocal in a breast, they are candidates for neoadjuvant, but they're not candidates for breast conservation because they're multifocal. So they will really end up having mastectomy, modified radical mastectomy. In our country, we do a lot of mastectomy rather than breast conservation for the simple reason that there are not enough radiation facilities in our country. So the women end up having the surgery instead rather than doing breast conservation because there's no radiation therapy that they can go to. So our patients, even if they would desire breast conservation, we cannot do them for a lot of them because of radiation facilities are limited. We're composed of 7,100 islands, and most of the radiation facilities are concentrated in the cities. So in the far-flung areas in the provinces, they don't have that. And if they have to travel, they have to travel by boat or by plane, and that is really cumbersome for them. In cancer patients, there's really the most important role of multidisciplinary management. I think no one doctor can take care of a cancer patient. I think more brains are better than one. So if we have a cancer patient in front of us and we have this diagnosis of whether it's breast, rectal, gastroesophageal, gastric, lungs, then we should consult with our peers from other fields like the surgery, the pulmonologist, the ENT, the GYN people. So we should put all our heads together and come up with the best treatment for our patients so we can treat them adequately and make them live longer. In our country, since we're in the Philippines, it took a while for us to practice the multidisciplinary, but thankfully we're really going into that. So most centers now are into the multidisciplinary setting, and most people have agreed to that. And we also are thankful for our government. So right now we have a universal health care, which we're looking forward to and which is funding the cancer patients. And we're very happy for that. And because you know that the drugs that we give, especially nowadays, they're quite unaffordable for a lot of majority of our cancer patients. And the government is really trying hard to help these patients be given the appropriate treatment and not be saddled with debts. And of course, with that, their family will suffer. So We're thankful for that in terms of the having this universal health care.